bad stuff. What can we kind of do? Well, you know, a couple of things that we've talked about before, but kind of bring up because it's the anniversary. Lots of natural products. Now, back to the, you know, the 138 Hiroshimas. This is equivalent to back in World War II when they dropped that. There were these classic type of studies where there were two hospitals. One was the typical Japanese, but they did the American, you know, medical establishment, which, you know, doesn't help very many people, but, you know, that's what they did. And they had another hospital there where they did more traditional type of Japanese, where they fed people brown rice and miso and seaweed type products. And guess what? All the 3,000 people in the traditional American, you know, approach to so-called sick care all died, and none of the people died in the so-called alternative type of hospital there. So kind of an interesting story here. But let's talk about health physics. February 2004, strontium biokinetics and human influence of alginate in the uptake and ingestion of strontium-90. So by taking an alginate is a component of seaweed. So this is scientifically proven that, you know, these alginates have a factor, not 100%, but something to do. Plus, as we'll talk about, these seaweeds, which are really kind of miracle foods, superfoods, have other benefits. We'll talk about one of my favorites, a brown algae, does other benefits than just preventing radiation exposure. Here's another study in the Canadian Medical Journal. Oh, that's right, another drug journal here. Studies in the inhibition of intestinal absorption of radioactive strontium-90. So, you know, science is very, very clear that these natural foods, even though it's not a drug, have very, very powerful effects in terms of the best type of thing, preventing things from happening. There's a classic study from the University of Utah. That's right, another university study, peer review, showing that for every dollar spent for prevention, it saves $16. That's 1,600% return on investment. But unfortunately, the medical establishment is a sick industry. They don't want to prevent anything. They make lots of money. They don't want to prevent cancer. That's a $600,000, you know, basically, you know, fun day making lots of money, which could be prevented. Another study from McGill University in Montreal showed the reduce of, once again, strontium-90 after just using, you know, using simple type of algae. Let's see here. Seaweed maybe helps rid the body of strontium-89 and 90. Helps with radioactive isotope cesium-137, iodine-113. So these are, once again, simple type of things. Another important fact was back to that study from Hiroshima, is using miso. Miso has been shown. There's different types of suspended type of clays that have this chelating effect. There's French, there's other kinds that are available out there. So these are some things that you can do. But let's go back to seaweed. So let's pretend that, you know, you're not worried of dropping dead of cancer, the fastest growing type of thing, ugly disease costing trillions of dollars. What else does it do? So let's talk about one of my favorites. It's a brown algae. And what does it do? It's a super antioxidant. So in this particular, it's 100 times more antioxidant than vitamin C. So that's good. How about brain function, mental relaxation, and alertness? Helps with Alzheimer's and dementia. Now, there was a big study that was done for Alzheimer's, and even though we're spending $90,000 per Alzheimer's patient, once again, wasted money, they concluded that there's nothing out there that helps this particular disease. They have nothing in terms of the drug industry, but we still spend $90,000. How can you have an industry that knows it doesn't work but still continues to do it? Well, people make money. Here's a study showing that it helps with fibromyalgia, that within 8 weeks, in this double-blinded type of study, is that 80% of them had better sleep, fibromyalgia, boosted energy in 71%, and once again, gave them a better quality of life in 39%, just within 8 weeks. How about, it's a neuroprotective, so it helps the nervous system. We already talked about that. It's an anti-inflammatory, so it helps with inflammation from cartilage. Actually was compared to Celebrex. Celebrex is about a $200 a month piece of crap that kills more people than AIDS does. It's in a classification called non-steroidal anti-inflammatories, and that was published in the New England Journal of Medicine in 1999, so we've known that for over almost going on a long time here. Showed it actually beat that in terms of helping with pain. So you can take Motrin, Tylenol, Celebrex. Vioxx was taken off the market because it killed more people than in the whole Vietnam War, but that's okay. They made lots of money. what other industry can kill that many people in a whole war and still be in business? There isn't any. Cartilage protective, helps with allergies and asthma. This is, once again, we're still talking about one compound. It's a brown algae. It's a food source. Helps with heart disease, prevents heart attacks and strokes. Hypertension. Here's a fun one if you don't have anything else. Actually, it was compared to Viagra. Viagra is what's called a nitric oxide enhancer. Helps increase and relaxes what's called the endothelial cells of the blood vessels, so it increases blood flow. Now, erectile dysfunction, that's what Viagra is used for, is actually a disease. You don't have a Viagra deficiency, you're just sick, but this drug is able to dilate the factor like that. But, this was actually shown to actually be more effective than Viagra. But, hey, who's going to pay, $6 a pill for Viagra? Oh, that's right, because Medicare pays for it. So I'm not going to go out and spend, $30 for some seaweed that does all this stuff. Helps reduce weight loss. Did a number of studies in 2 weeks. Their average weight loss was 2.5 pounds. Helps with diabetes. So once again, it's too scary for a drug company to have a natural thing that does equivalent to 12 drugs. They'd rather have, once again, Viagra that causes blindness and heart attacks. They'd rather you take Celebrex that causes kidney damage, liver damage, causes destruction of the joint, because now they're able to then, when you have destruction of the joints, now they have to do a knee replacement. Hey, $50,000 in my pocket that I caused 5 years ago, or causes kidney and liver damage. That's okay. Pete down the hallway, who's the liver specialist, now he's going to get his $90,000 for something that we started back then. But don't confuse me with the facts. Jack, just once again, watch your TV, have your Medicare insurance pay for all this kind of garbage like that. So, that's what we have. Dangerous times, start acting. We've given you some suggestions to do in terms of reducing the amount of toxic stuff from this radioactivity and the poisons that are out there.